All right, welcome to UroChat. This segment's definitely different and really special. In studio, we have Dr. Blick as well as Harold. Harold is a prostate cancer survivor, and as we're going to hear, unfortunately, his journey's left him with some complications. And so, Harold, thank you for being here today.
Thank you for asking me here.
Absolutely. Do you mind, and also what I wanted to share with everybody is that what's different today is we're going to try to facilitate a conversation between Harold and Dr. Blick about erectile dysfunction. And so we're going to have a straightforward conversation, and this is a great opportunity for you to ask a board-certified urologist any questions you might have about erectile dysfunction as well as different treatment options.
Let me ask you, Harold, when did you first have your prostate cancer surgery?
In February of 2018.
And before the surgery, did you have any problems with erections?
I did. I had ED issues prior to surgery, and I was taking some of the medication and the pills.
Did they do a nerve-sparing prostatectomy on you, as far as you knew?
No. The way it was described to me when the surgeon was talking about doing this procedure is they could do nerve sparing, or they could go what he called as wide. And I imagine that's probably familiar.
And it's important because he wanted to get all the disease out, so he did the right thing.
Right, and that's what he explained to me, and I just felt at that point that that's the direction I should go.
You did, yes, that's fair. And then after the surgery, did you then experience problems with your erections?
No erections after the surgery. It just had a lot of incontinence, first through that recovery period, and no erections after that.
And I'd like to add as well, I think Harold chose, you chose the right decision. You're looking at your life versus quality of life, and so there was a real decision to make, and so I compliment you on having the radical surgery, allowing the surgeon to go wide, which saved your life. I assume the PSA is low now and the cancer is in remission?
Yes,
Okay.
it is. It's 0.1.
Excellent.
Fantastic.
Yeah, so
That's
the
great.
doctors keep saying that that's really great. So
as a prostate cancer survivor, what journey have you taken to try to help your problem with erectile dysfunction?
the journey I started actually at the VA. Because they had a procedure to try to strengthen, is it the pelvis muscle or
Like a Kegel exercise?
yeah, Kegel, that's what it is, sorry, Kegel exercise.
To help you with your leakage.
Right, and that's what I first dealt with, is a lot of leakage. And then from there, I couldn't get in the with my doctor, so the VA put me into a program to start working on that with them, and I forget what they call it, but it's
Pelvic floor rehabilitation.
okay. Thank you.
And strengthen the pelvic floor to gather more strength so that you would gain your continence back, or your ability to hold your urine properly.
Right.
And that, I assume, got to be controlled, correct?
Yes, pretty much. And then right after that, then the VA actually put me on the pump.
The vacuum device?
A vacuum device. Yeah, thank you.
To try to help with your erectile dysfunction.
Yes, tried that, and they took.
What was your experience with that?
Not good.
It was difficult?
Yeah, it just. It works, but it doesn't hold the blood.
Sure. Any other things that you tried along the way over the last year since your surgery?
Right. After that, then the next step was the VA started the injection treatments, and they only have one particular prescription that they use, and I went through 3 different doses with that.
That was probably prostaglandin E1, most likely, as a single agent.
Okay.
Just for the audience.
Okay. And after that, I still didn't have the results I was looking for.
And then from there, you tried something else?
Well, the VA doctor suggested that I talk to my doctor, my civilian doctor, and suggested that I try to reach out to him to get the trimix and try that procedure. So I went through that procedure on all three. There's 3 different levels of dosage, and so I went through that, and still, at the end of that, still wasn't achieving the firmness in the erection that I needed.
So the trimix is actually a mixture of 3 different agents comprised of prostaglandin E1, papaverine, and phentolamine, and together they're stronger and they work together, and even that didn't really give you an erection satisfactory for intercourse, and we call that erectile dysfunction. So on a scale from 1 to 10, with 10 being rock solid and 0 being soft, and maybe 7 you could just penetrate, what do you think your score would be?
Probably somewhere around 4 or 5.
Okay. And so after undergoing prostate cancer surgery and the better part of a year of recovery, it's fair to say that through taking pills and injections and vacuum devices, we still haven't succeeded in gaining an erection satisfactory for intercourse.
That's correct, doctor.
So, have you ever heard about a penile implant before?
I had the urologist that I've been with for the last over a year had showed me what the device was and what it looked like, and but that's, you know, kind of as far as he went, you know.
Because certainly you could have gone with that urologist. Was there an issue there?
Well, I felt like the urologist was good, and through that process of the prostatectomy.
Treating your cancer, right?
Yes.
Okay.
Yes, exactly. Treating the cancer. But I felt like it was not what I was looking for as far as level of comfort and trust and comfort. And I just felt like I wanted somebody that specialized in that, because the way it was explained to me is that you don't, that's it. It's a decision. Once you make that decision, you can't reverse it. And
it's a very delicate part of the body, right?
Yes. So I wanted to be as informed,
Sure.
and I felt like I really felt more comfortable being with somebody that was an expert.
Right. So what you're looking for is something called a prosthetic urologist, someone who specializes in placement of prosthetics, if you would, or internal devices that can restore your ability to have erectile function, or sometimes in the case of urinary incontinence, restore your ability to have the ability to hold your urine. And it's a very specific subspecialty in urology, and only 5% of all the urologists do the majority of all those implants that I'm making mention of. So your inquiry into finding a specialist in that area is well suited. You do want to find someone who does a lot of this work because it's very technical work, and you want to have somebody who does a large number and has good outcomes.
And I'd like to commend you as well, Harold, for going with your intuition and your gut instinct that this may not be the right fit for you, right? As a doctor, I went through that myself during my cancer battle. I saw a leading oncologist who had recommended chemotherapy, but he was more of a researcher than he was, an actual applied practitioner. And so, I really valued his advice, but then I chose to actually come back here and go through my chemo with my own oncology team that I was familiar with. And so I think that that's something that's really, we've spoke before about a lot of different aspects of, urology and cancer. We've spoke about positive attitude, but I also think that gut instinct has a lot of value as well, Dr. Blick.
Yeah, I think it's important to find someone you feel comfort with and that you can communicate with and share some of your innermost thoughts and fears, and someone who's comfortable in relating with, because that's the trust in your surgeon or your physician is really important.
Absolutely.
Oh, absolutely. That's really important, and I guess those are the reasons why that I just felt my civilian doctor, that's not his focus, and that's not a bad thing, but it's just, it wasn't his area of expertise, and kind of felt like I'd just be a number, And I don't want to be a number when you're making it's a huge decision.
Yeah.
And
Yeah, you're correct.
so you don't you can't go back. So I felt like I really needed to be in the hands of somebody that really was an expert in their field.
Well, what you've gone through is not really very uncommon. A lot of the conservative options that are available for erectile dysfunction share a few things in common. They're not always spontaneous, they're not always reliable, and they have ongoing side effects and costs. And as a result, when people embark upon these conservative measures, unfortunately at the end of a year, a majority of the men are not staying on them because of all those reasons. So you're not alone in all that process. There's takers for all the options, for sure. But in the tour de force of things, most men eventually fail those options and they're looking for a long-term solution for their erectile function. And a penile implant is, in my mind's eye, the single best treatment option beyond the pill because it's, first of all, internal, it's part of you naturally, and once it's complete, but it solves all those issues. It's completely spontaneous, virtually 100% reliable, and there generally are no ongoing side effects and costs, especially when insurance covers it. So it could be an awesome solution for you, and from what I've heard so far, you'd be an awesome candidate. Now, do you know a lot about penile implants?
Not a lot.
Not a lot?
Just the basics, I think, and I've seen the device through my regular doctor, but that's pretty much about it.
What are some of the main questions you would have or you do have about the implant? So what I'd love to do now is facilitate a conversation about the actual thoughts that you have about the process, because a lot of people will be viewing this and they may not have the opportunity to sit at length with their doctors. So I just would love for you two to have a good conversation about what are your thoughts and concerns and questions you may have about the actual procedure itself.
Okay. All right.
Well, I can just start by giving you a little information, maybe, and then as I go, you please feel free to answer questions so it's just not me talking the whole time.
Right. Okay.
But for simplicity, there are different kinds of implants. There are malleable implants, which are semi-rigid or always sort of a little bit hard all the time. And then there are inflatable implants. But for the most part, in the United States anyway, we're usually talking about inflatable implants. Why? Because they're the most commonly done, they have the highest patient satisfaction rates, and they're the most cosmetically appealing. That being said, there are different kinds of inflatables, and there are 2-piece inflatables and 3-piece inflatables. But for sake of discussion, we usually talk about 3-piece inflatables, again, just because of their superiority in patient satisfaction. So if I was teaching you about 3-piece inflatable, what are those 3 components? First of all, it's an internal pump that goes inside you, invisible, right? And that internal pump consists of a small pump that lives inside your scrotum, a reservoir that holds salt water, so it's not toxic, and it connects to cylinders that go through the shaft of the penis, such that when you pump the pump, salt water moves and creates a rock-solid erection that lasts for as long as you want, whenever you want. So already, doesn't that sound interesting?
Yeah, it does. It sounds very interesting, especially going through all these other steps to get to this, point. It sounds very interesting.
So now, if I follow that, I usually will tell people that it doesn't affect your sensation. It's not going to affect your orgasm as you know it or your ejaculation. It's invisible. It's kind of natural, feels good for you and your partner, and it's extremely durable. Like we quote 90% success at 10 years, so it's a very durable product. As far as infection rates, some people ask me that, will it get infected? Well, the product is antibiotic impregnated and it reduces the infection rate to less than 1% in high volume implanters like myself. When you put all those features together, people report as high as 97, 98% patient satisfaction because it's spontaneous, reliable, without side effects and cost. So the next thought is, well, how does the process work? It is a procedure, it is a surgical procedure, and we do that through a small opening where your pubic hair is located, and we do the whole thing in 35 to 45 minutes through a 1-inch opening, and you go home the same day.
Wow.
Wow, that's
Interesting, right?
yeah, and that's pretty fast.
It's pretty good.
Yeah.
So it's a modest recovery, and most of the recovery is over by 3 weeks. And that's when I can begin teaching you how to inflate and deflate the device and get you to a place where you can begin to use it that fast. Now that being said, do you have any questions?
The only one I was wondering is why would people choose the other inflatable device over the three-piece device?
It's a good question, like a two-piece versus a three-piece.
Right.
The two-piece product doesn't have a reservoir separate. So it's really only consisting of a pump and cylinders, and the fluid lives within the cylinder itself. So what if someone had such a scarred pelvis that there was really no place to put a reservoir, like somebody who had a transplant kidney, who's had previous surgeries before in the abdomen, it's all scarred, trauma. Well, then you might put a two-piece just because of simplicity, don't have to worry about the reservoir going into the abdominal space. That's the reason why. But as you can imagine, there's less fluid moving, so there's less movement between the rock hard erection and the soft, so it's less range. So the penis stays a little bit firmer on a regular basis, and the inflation process differs because the way to get the fluid away, or to release the fluid from being rigid, you just bend the penis, it sort of releases a valve internally, and then the fluid drops into the bottom part of the cylinders and gets soft. So it's a little less range, it's a little less rigid, and a little less firm all around. So as a result, people choose a three-piece over a two-piece if they can.
The breaking of the penis didn't sound great.
Yeah, fair enough. It just has a little bit of a less of a range of what from hardness to softness. And there's a little difference in the inflation process, and that sometimes deters people, steers them towards a three-piece.
Yeah, I didn't realize that.
So that would be the reason why you'd choose a three. You have normal dexterity in your hands. You have no reason that you wouldn't qualify for a three-piece implant. Your abdomen is not scarified in a way that would prevent it.
Right, okay. Okay.
Other thoughts that you might have?
How do you decide, because there's the parts, I don't know what the terminology is, that goes actually these chambers that go inside of the penis. How do you figure out, you know, I guess there's different, I've heard there's different sizes and...
There are different sizes, and we can customize it to you. So one way to get a realistic expectation about your size is to pull the penis on maximum stretch. So if I stood you up, and we're not going to do that here, and I pulled your penis on maximum stretch, I could get an understanding about what the realistic length would be. Girth is always proportional to your girth. And once we're in the operating room, we have with the choice between choosing like a 12 centimeter implant, 15 centimeter implant, 18 centimeter, 21 and 24, and all different kinds of rear tip extenders to make up your perfect size. And I will find your penis on maximum stretch and customize the size to make it so that when you inflate, we have maximized you to the best of our potential.
Oh, that's interesting.
Right?
I'm glad you explained it.
Or some of your concern that if there's no other way to explain this, I guess, but if your penis is 6 inches, you know, when fully erect, but they only do a 2-inch implant, then 4 inches would not be firm enough. Is that kind of what you were concerned about?
Right.
That's what I was thinking.
Exactly.
As well. Yeah.
Exactly
Okay.
that.
My job is to suit your penis at maximum stretch with the right implant, so that artistically, when it's done, it comes out as erect as it can be, potentially. So we optimize you to the best of our ability.
Right. And I have one, that brings up one other question, is after you do that surgery, the implant and everything, do you actually experience, like the terminology, rock hard, like I did in younger days, you know, prior to...
So you will get an erection that is very firm and not bendable, that will allow you to have normal intercourse again.
Okay.
Your sensation will feel just like it did before, because we won't involve the nerves in any way. What's interesting is some people ask me, do they feel the same sexual tension? You know, because you're not going to get an erection the way you used to get it.
Correct.
And the answer is yes. You can create the same kind of sexual tension. Once your implant is inflated, you'll still get the same urge and the same tingles in your body that make you feel, let's just use the word horny or sexually excited.
Right.
And your ability to have an orgasm is the same. Some people say after sometimes you've had your surgery, they'll say it's harder to have an orgasm, but once an implant's there, you can control your sexual experience completely. So you can slow down, you can go as fast or as slow as you want, and you can allow your sexual tension to rise so that you're more likely to have an orgasm, whereas sometimes before surgery, especially as men age, they may have more difficulty having an orgasm. This allows you to potentially have a higher chance of obtaining the orgasm. So you keep all your sensations and you keep all the rigidity to have normal sex like you were when you were younger. You'll probably be a little different than you were when you were younger. There's just like a knee replacement or a hip. You're not exactly like you were when you were younger, but you're functional. And you're completely, you'll look natural, you'll feel natural, and you'll be able to function again and be back sort of in the game.
Right. The other thing, so there must be a correlation between that firmness of the penis and the ability, of course, to have an orgasm, but the firmness, I guess, that has something to do with that then?
I know where you're going with that question. Some people will say, can you have an orgasm without an erection? And the answer is yes, you can. Having the erection creates sensations that start to stimulate in your brain that you're excited. So once you're inflated and you've gone through a manual process of inflating your implant, all the same sensations and rise in sexual tension can ensue as naturally as they did before you had the implant.
Okay.
That help?
That explains it. That really does explain
I'll share
it.
this with you to expand on that point. This is something I don't recommend anyone ever try at home, but I was so curious after my prostatectomy if I could still have an orgasm. Now this was 7 years ago, before radiation, before Lupron, and I actually was able to achieve an orgasm with the catheter still in because I was so curious. This is just 2 days after surgery. It was not a great idea. It's not very smart. I wouldn't recommend it. But I think to your point, though, you can achieve the orgasm even without having any natural erection. I think that's what we're really looking into.
Absolutely, it's possible, yeah. But I'm trying to think if there might be any other questions you might have. I would say to you, being part of the VA, you would be covered financially, like to have an implant. But in the Phoenix market, most commercial insurance payers do pay. The only that don't are Blue Cross Blue Shield and Cigna. But United Health, Aetna, Humana, Medicare covers, TRICARE, and VA will cover. So financially, you're covered to have this benefit.
I think that's important too, because that's another question when you're thinking about this process and the surgery is does Medicare, does TRICARE, do they cover the procedure? So that's good you're sharing that.
Did you have ongoing expenses with other treatment options, like with Trimix?
Yes.
Trimix or Trimix?
Trimix.
Trimix,
Yes.
Or if you're using Viagra, any other treatment options had ongoing expenses, correct?
Yes. The Trimix, it's all out of pocket because it's not a prescription that any of the insurances, I guess, recognize.
Or deemed medically necessary, right?
Potentially. It just depends on the insurance plan or the compounding pharmacy that you work with. Sometimes they just do it through cash basis.
Yeah.
So it sounds like a huge benefit of having the artificial
The penile implant.
Yeah, is that you're not going to have to worry about ongoing expenses, correct? I can't see any ongoing expenses here.
No, there will be no ongoing expenses, and you don't have to worry about traveling with needles or anything like that. And this does not go off in the airport. So there will not be anything going off
yeah,
there.
that's a
That's right, so you don't have to worry about that. Some people ask me what happens if it breaks.
Oh yeah, that's a good question.
We can take an old one out and we can put another one in. Not a problem at all. And I like to quote 90% success at 10 years. So how old are you now?
66.
So you're likely to be 76 years old with a functioning implant 90% of the time. And that doesn't mean it blows up at 10 years. It just means statistically speaking, there'll be some who will go longer and shorter. So we have people out 12, 15 years with a functioning penile implant. Unfortunately, at times, depending on usage and how it's utilized, sometimes it'll break in 8 years. It just varies, but you get the feeling of a durable, long-lasting response, and if it breaks, we can just fix it and put a new one in. Pretty neat.
And
That
when it
is-
breaks, oh, sorry, Harold.
No,
And,
that's
I was curious. So when it breaks, does it mean does it break, or is it not work as effectively over time, and that's when there's a red flag that needs to be changed?
Usually there's just a breaking in the tubing.
Okay.
And what happens is salt water slowly leaks out over time, and then eventually the pump just doesn't work anymore. And you kind of come in saying, wait, my implant's just not working.
Right.
And that's all there is to it. There's nothing toxic about it. And then it just becomes a visit to the doctor saying, I think my implant's not working. We check it out, we make sure it looks to be that, and if it is, then we schedule a removal and replacement.
And can you determine that on just physical examination?
Yeah, I can tell pretty quickly whether it's working or not, or if there's something with the pump. If something I can fix with the pump, I will, but otherwise, in general, I can just tell by the squishing sound that there's air in the system. Okay. And then you can kind of tell and it's just not working, and you know it's broken.
So you're not required to go back in for additional CT scans or MRIs, no more exposure to radiation, just physical examination, he can tell that it needs to be?
In most cases.
Most cases, yeah. Okay. Mm-hmm. There's some exceptions, but for the
correct. For the majority of it, it's just a simple exam, and I can tell right away. And usually, it implies we'll take out the whole implant and just put a new one in, for the simplicity of it. And especially if it's been in that long, it's hard to want to just tack on a component to an old product. You may as well just replace the whole product and give you a brand new one for the years to come.
That brings up another question. Sure. If that fails, let's say after 10 years, then do you have issues with the insurance to replace it?
It's a great question. I can't answer that question because we know that there could be changes in our politics or economics that could change the healthcare system and what it would cover and not cover. I can tell you that for certain we do, even today, cash pay business. That means there are people who have healthcare savings plans or are just not covered and wish to proceed with an implant, and we do a cash pay basis. We charge $16,500 to cover the entire thing. That's the implant, the surgery center, the doctor that does the surgeon that does the work, the anesthesia, all of it, completely covered, one check finished. So it's a pretty good price. If you actually went out there and looked around for cash pay implant, you'd be like, that's amazing that you get that all done for that price.
And that's worst case scenario, maybe 6-10 years down the road, if the implant doesn't work, right?
Exactly. I mean, for now, I don't see it anywhere in sight that we're not going to deem this to be a medical problem. Erectile dysfunction, as we discussed, is a medical problem, and I think we view it as such, and we know it's a risk factor for heart disease, and we know it affects people's psychology, and so we know it has profound effects on people's quality of life, and so we're empowered to maintain it as a medical problem and maintain it as a benefit to the men that suffer from this. Just like females that suffer from, let's say, breast cancer.
Right, yeah.
So I don't think it's going anywhere anytime soon, but I can't predict it. I don't know the answer.
Right. Well,
I'd love to know the main apprehension you would have as a patient considering this procedure. What would be the number one apprehension you would have towards when you consider the surgery, whether I do it or do not do it?
At this point, I don't think I really am, that concerned about it. I feel like it, that I feel like I'm in good hands, and
Thank you.
So that was the concern then initially. The main concern was being in the right hands.
Yes, and somebody that really specialized,
Sure.
and in the procedure. Of course, infection, was a thought in the back of my mind too. But after Dr. Blick explained all that, I really don't have apprehension about it. So.
Now you're probably excited to do it, right?
Yeah. I feel like that's the next step.
Oh, that's fantastic.
It's encouraging. I would be excited to help you. I try to pride myself on high quality work, a certain sense of perfectionism, certain sense of sensitivity though to the whole issue, and openness so that we have like this kind of dialogue. That this is very typical of what an office visit would be like, where we just have open dialogue. We're free to talk about all the issues. We cover all of them, so that when you're finished communicating, you feel like all your questions were answered, and you have realistic expectations about what this is like, so that we've not put anything behind a sleeve. Everything is out, so that you feel comfortable. So I kind of try to pride myself on that, that I've offered myself to you, I've given you all the information, helped you make a good decision that I know is going to be a life-changing, transformational procedure for you in your life, and how it'll affect you and your wife.
I like that.
Yeah, it's be awesome.
Yeah, I really like that. I like the fact that that's what your focus is, and you care about it, and you're, I don't know, I don't know how to put it. You're, 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 I don't know how to p you pay attention to all the little details that are important, absolutely important when you're doing something like that.
Yeah. Both in the process post-operatively, but also intraoperatively. Like there's just a lot of detail, and you want someone who's really in tune with the finesse of this procedure so that it comes out awesome.
Yeah, you don't want the doctor having their first rodeo, right? With you.
Right, yeah, no, definitely not.
And we can do as many as 10 or 15 in a month on average.
Wow.
So it's really, we're really quite busy in that space. But any other questions or thoughts that I could answer for you at this point?
I can't think of any right off the top of my head. I do feel very encouraged and feel much more relaxed and comfortable knowing all the information here. And like I said, I just feel like I found the right doctor. So.
Fantastic. Well, Harold, I'd like to salute you for your service and thank you as well for being brave enough to share your story and to have an honest conversation with Dr. Blick. And Dr. Blick, thank you as well for being here.
It's my pleasure.
Been guiding Harold through this next chapter in his journey. So also before we wrap up, Dr. Blick, if other men are interested in reaching out to you to talk about their erectile dysfunction issues, where can they reach you?
So you could either go to my website, drblick.com, and you can spell out the word doctor, drblick.com, or
I hear you have a podcast.
yeah, I'll give you the number, 602-931-4556. That's 602-931-4556. Or I have a podcast called Blick's Dicks. It's kind of funny, but we're trying to create a new metaphor for men's health in the United States or maybe even worldwide. So you can tune into Blick's Dicks and Apple Podcast.
Fantastic. Thank you for being here, Dr. Blick.
Pleasure.
Harold, thank you as well.
Thank you, Steve.